I had a different speech ready for you today until the vote, but then when I went to revise it this morning and yesterday afternoon, I realized that the more things change, the more they stay the same. And that's really what's going to be my message to you today. I have several objectives. I want to talk a little bit about what has been going on with this defund movement. I want to talk to you more about what we actually do here in the Mid-Hudson Valley. I want to talk to you about what the continued threats really are to women's rights and women's health care in the United States, what's happening and happened to women in other states across the country when politicians and ideologues get involved in setting policy for women's health, and talking about the future and where we may have to go from here. I think it's interesting that anyone under the age of 44 years old has never lived in a world where they did not have complete access to every aspect of reproductive health and contraceptives, and that is the world of post-Roe v. Wade. We believed our rights were secure, and I think maybe we became a little bit complacent, but with the election of the President, the Senate, and the Congress, reality was thrust right back in our face, and we are now facing the greatest challenge in my lifetime. And I was right there in the 60s and 70s hoping to get the rights that we did secure under Roe. The administration has made it incredibly clear they're dead set on defunding Planned Parenthood. And they buried it in legislation to repeal and replace the ACA. And I found it very interesting watching news programs where they would be talking, someone would raise the issue about defunding Planned Parenthood, and the congressman would deflect it and start talking about the ACA. They did not want it to become the prime issue, but it is the issue that brought out the pink scarves and the protests, and very happy to say that we were on the leading edge of making sure that a lot of those rallies happened. I won't go into detail on what happened last week, but we do know that they chose not to vote on the repeal and replace, and therefore we scored one. We bought some time on Friday. It was really a split within the Republican Party that brought it to the head, as much as our president would like to lay it on the doorstep of the Democrats. But it was the fight between the Freedom Caucus and the more moderate Republicans that brought them to the point of realizing that they were not going to have a vote. At the time, right immediately after the vote, I was on the phone with all of the CEOs in the country and Cecile Richards, who is our wonderful president of Planned Parenthood Federation of America. And we kept saying it is made clear that we dodged a bullet for the time being. However, we have got to be extremely vigilant and not assume that we will not continue to be targeted. In April, we're looking forward to an appropriations bill, and that's another opportunity for Congress to try and do away with one of our funding streams, which is Title X, that helps provide contraception services for low-income women. It also helps us slide our fee so that women who are very low income don't have to pay as much or don't have to pay anything. I also had this reaffirmed to me this morning while I was watching CBS Good Morning, where they were discussing President Trump's tweets just yesterday, where he tweeted to the Freedom Caucus and said, "It's on your head that we will continue to have Obamacare, and all of you pro-choice, extremely right-wing pro-choice Republicans, it's also on your head that we still have Planned Parenthood." So we are continuing right there as a primary issue for defunding. I also found it interesting listening to our Senator Schumer on the same program talking about the budget that they're going to be looking at, saying that he would be very glad to work with Republicans to find a budget that would be acceptable to everybody, but they will not accept a poison pen amendment for such things that would include Planned Parenthood. So you're going to continue to hear Planned Parenthood be a lightning rod in the future. But just for this minute, just for this weekend, we're going to celebrate this success. And I would like to give a shout out to Ashley Casal. Would you stand up, Ashley, who is our public affairs manager, and Fran Fox Bizonia, who is our vice president of public affairs. Beginning just a few days after the election, Ashley got out there and she coordinated people across 4 counties and brought together hundreds of people in our health centers in those 4 counties to start an activist program. And Friday, she was able to rally over 120 people to stand outside John Fasso's office because he was ready to go ahead and repeal the ACA, knowing that Planned Parenthood was in it. One of the things that resulted from this fiasco is that Kaiser Health Systems did a survey, and we have finally reached 80% support in America for Planned Parenthood. That includes almost 50% of President Trump's supporters. In addition, Planned Parenthood has now accumulated over 10 million supporters nationwide, all because we were able to deliver a massive and effective and very timely response to this. So we have a moment, I'm going to tell you just a moment, to be proud and to build to start to prepare for ongoing threats. But if there's anything that we have learned, and anything that matters, it's that our voices matter, and our voices worked this time. So that is what our main message is going to be to our supporters is we cannot sit back now. We're going to have to keep working at this as if it were an immediate threat the way it was. We'll continue to rally supporters and work with our representatives to ensure women's rights. But as I will tell you a little bit later in my discussion this afternoon, we have been pretty smug in New York State, and our rights in New York State are very threatened, and I'll talk about that a little bit later. So none of what's happened in the last few days has negated the fact that our country is in control of ideologues who are very, very open in their opposition to women's reproductive health. I need you all here today to have a better understanding of several things. One is what Planned Parenthood means to our neighbors in the Mid-Hudson Valley and to the rest of the women that live across the country in states that are not quite as friendly to women as we are here. For millions of women, especially low income, reproductive health care is not a theoretical issue. It's not a social issue, and it is not a political distraction. It's a fundamental issue of economic security and opportunity because women cannot fulfill their dreams, their education, their business responsibilities, or their responsibilities to their families or their current children if they do not have an opportunity to control their fertility. Here in the Mid-Hudson Valley, we cover Dutchess, Ulster, Sullivan, and Orange counties and have health centers in Monticello, Goshen, Newburgh, Poughkeepsie, and Kingston. Last year, we conducted 19,517 visits. That was in 2006. We reached an additional 30,000 people through our education programs, and I believe we're in about 50% of the school districts in the 4 counties at this time, working with school health nurses, working with their health classes, etc. We also recognize that we in the Mid-Hudson Valley are not so different from many other communities where there are terrific and horrific health disparities between women of color and white women. So we went to a funder in Newburgh and we said, We really want to make a difference here. We know that women of color die more frequently from cervical cancer and breast cancer, not because they contract those diseases more frequently, but rather that they are not screened, and by the time cancers are discovered, they are much further along, resulting in a higher mortality rate. So we were able to use the funding through that donor to hire women of color, both Latina women and African American women, to go into neighborhoods where I would not make an impression on anybody. These were their neighbors, these were their peers. And I believe that within the first year of doing that, we saw over a 400% increase in the number of women who had accessed reproductive health services that we had never seen before. It was successful enough that we have replicated it in Poughkeepsie and have just gotten a large grant to be able to do this in Kingston as well. And so I share this with you because while abortion is the label that gets put on Planned Parenthood nationwide through the current, in the current political environment, we are really a public health service as well as a social justice organization. In the Mid-Hudson Valley, 85% of what we provide our constituents is preventive health care, the same things that you and I go to our gynecologist for. 15% is abortion, and that's because New York is a very liberal state and we have abortion rights here that many other states don't have. Nationally, however, 97% of what Planned Parenthood does is preventive work, and 3% of the services are abortion services. What's the picture of the people that we serve here in the Mid-Hudson Valley? Well, 85% of them are at or below 150% of the poverty level. That's a family of four trying to live here in the Mid-Hudson Valley on a salary of about $36,000 a year. Another thing that surprises people frequently is the age of the women that we serve. The majority of the women are 25 to 39 years old, and that's a time period when women are really planning their families and trying to be sure that they're getting all of their medical services. We have 18 to 24-year-olds making up 32%. And I think what surprises many people is only 2% of our population is under 18, whereas the picture sometimes is that we have all the teenagers, creeping in the back door, escaping their parents to get sex education and contraceptives. It's not true. I wish we had a higher percentage of young people, and we are working on that because we really do believe we can benefit them to prevent unplanned pregnancies. 60% of our patients say that we are the only healthcare service that they receive in any given year, and they primarily pay through Medicaid. 60% of our patients are on Medicaid. What we provide in the Mid-Hudson Valley are the kinds of things, as I said, that you and I would go to our gynecologist for, primarily birth control. And I do want to say that in the last few years, nationwide, especially with Planned Parenthood, being able to help women get long-acting reversible contraceptives, which are IUDs, we've seen unintended pregnancy rates decrease in the last several years by 20%, and teen pregnancy rates by 40%. In some places in the country, it's 51%. So when we're talking about doing away with Planned Parenthood, you're talking about doing away with an organization that is preventing more abortions in this country than any other organization. We also do clinical breast exams, screening for cervical cancer, testing and treatment for sexually transmitted diseases, HIV testing, and most recently, we are very proud that we are now offering gender-enhancing hormone therapy for transgender patients. So, thanks. As a matter of fact, we had no idea how incredibly needy that was. We started in November, December, Patty? I'm trying to remember. And we have 25 or 26 patients that have already come to us because there's no services between New York City and Albany. So we really feel that we're making good on a promise to the LGBTQ community. In the last couple of years, as you know, we have become a lightning rod. We became a household word, and that's primarily because we do provide abortion services. The landscape has become politically much more conservative, and as I said, only 97% nationwide, not only, that 97% of what we do is preventive. But it's because we offer abortion services that we have been targeted, and that's very clear from what just happened in this legislative session and in the bill to defund Planned Parenthood. So I want to talk just a minute about what it means to defund Planned Parenthood and what it would mean to millions of women seeking services if we were to be defunded. This is how we get paid for services. You may have heard that there was a lot of talk about why should Planned Parenthood get $550 million a year from the federal government. When Cecile Richards was testifying before Congress last year, did any of you watch any of that? She's her mother's daughter. It was an amazing presentation that she did. And they kept going over and over and over, why should we give you $550 million? And she would answer a question and they'd say, but we're giving you $550 million. And she finally looked at the senator and said, are you assuming that we're getting a check from the federal government for $550 million? And he was somewhat taken back. And she said, sir, no, what you're talking about is the fact that we are a healthcare organization. 60% of our patients are on Medicaid. And therefore, when our Medicaid patients come in the door, they are giving us their insurance card, and we are billing Medicaid for the services rendered, such as breast exams, such as pap smears, et cetera, et cetera. So the $550 million that you may hear thrown around as going to Planned Parenthood is not a check. It is reimbursement the same way we get reimbursement from Blue Cross Blue Shield or any of the insurance cards that you may have in your pocket. What the ACA proposed to do was to eliminate us from billing the federal portion of Medicaid, which is 90%. So we haven't begun to see how this attack may continue. What we do know is we also receive federal funding through what is called the Title X grant. That's a grant that provides family planning organizations across the country money to be able to ensure that low-income women who have no other sources of payment are able to receive services and have them paid for. That also allows us, as a Title X recipient, to be able to access very, very discounted drug services, which also that discount gets passed on to our patients. And it also helps offset the evidence-based, medically accurate health care, sex education that we are doing in the schools. I found it very interesting, and I hope you do too, that federal funding for family planning has a very conservative history. It's of interest that it was George H.W. Bush's father, Prescott, who was involved with the American Birth Control League back in 1942, and he served as the first treasurer to Planned Parenthood's capital campaign in 1947. He was a leader in the Planned Parenthood movement and on the national board. Also in 1970, conservative President Nixon signed into law the bill that established the Title X family planning program. I love these numbers because of what's happened in the last couple of years, but that family planning bill was passed unanimously in the United States Senate, and it passed the House by a vote of 298 to 32. That's what conservatism was not too long ago. George H.W. Bush became a principal Republican backer of the family planning legislation. But I will say that support for Title X wasn't necessarily altruistic or ideological. It was clearly an economic issue, because it has been shown over and over again that a dollar spent on family planning prevention saves the government $7 in supporting unplanned pregnancies and births. I think the most recent estimate that I was able to find is that the family planning grant over the years has saved 1.94 million unintended pregnancies that would have resulted in 860,000 unplanned pregnancies brought to term and 810,000 abortions. So it really is going against their own philosophy of trying to prevent abortion services. Again, they target Planned Parenthood and family planning dollars because we do provide abortions. However, the Hyde Amendment, which was signed which Congress passed in 1976, is a legislative provision that bars the use of any federal dollars from providing abortion. That's not just Planned Parenthood, but if you have TRICARE and you're in the military, you also cannot use your federal insurance to cover abortion services. There is a provision in the Hyde Amendment that does say that you can use federal dollars to pay for abortion only in the case of incest, rape, or to save the life of the mother, and that was affirmed in 1980. There have been dozens and dozens of congressional attempts over the last couple of years to investigate Planned Parenthood, to show that it is violating the laws surrounding the use of federal dollars to provide abortion, and absolutely every attempt has been defeated. They have not been able to find anything. None of this, again, has stopped the escalation of calling for the defunding of Planned Parenthood. And I'm going to tell you a little bit about not just what's happened at the federal level, because women in this country have been suffering under what some of the states have done. And this has been a real concern because right now, a woman's access to reproductive health really does center on where she lives in this country. Since July 2005, at least 24 states have taken steps to blocking certain women's health providers, such as Planned Parenthood, from participating in federal health programs for women. And these are mostly low-income women. In the first 3 months of last year, across the country, politicians introduced more than 400 new abortion restrictions that put reproductive health care, the full range, out of the touch for women in this country. And again, that's mostly low-income women and women of color. I'll give you a primary example of Texas, which many of you might have tuned into. We were fortunate enough last year to have my CEO colleague from Texas come speak to us at the Wallace Center at FDR Presidential Library. And he spoke to us about Texas being a cautionary tale. Because Planned Parenthood in Texas does offer abortion services, Texas cut the support for the family planning program, which of course is the most successful way to prevent the need for abortions. A year into that, 5% of Texas women who were polled said that either they or someone they knew had tried to self-induce an abortion. The New England Journal of Medicine pointed to the alarming picture that in Texas, there were 35% less women able to get a hold of contraceptives because of what they had done to Planned Parenthood. That resulted in a 27% increase in the number of unplanned births. And I want to emphasize again, these horrors were perpetrated on women based on the fact that 3% of the services that Planned Parenthood in Texas offered were abortion services. Women did not start having abortions because Roe v. Wade was signed into law. They just stopped dying from abortions. So Texas now serves 54% fewer family planning patients and has lost 25% of its family planning services. And again, I want to emphasize, because of the mission that all of you are so involved in, this disproportionately affects low-income and women of color. As a result, birth rates, unplanned birth rates for women, low-income women and women of color, are 5 times greater than they are those for women of higher incomes. We're really being held hostage to ideological positions. I'm going to tell you how bad this got for one of my colleagues last year. When you go to the doctor, or when you even go to your dentist, you usually sign a form, the HIPAA form, that guarantees your privacy for the services that you're receiving. Last year, senators in Missouri attempted to hold the CEO of Planned Parenthood in contempt of court under threat of jail time because she refused to submit the private medical documents of Planned Parenthood patients. She was subpoenaed and was and called for her to turn over any and all consent forms by patients in the process of receiving counseling or abortion care at the St. Louis Health Center. This would have released all of the names of those women seeking that service, would have released them to elected officials. Of course, the lawyer representing her did respond that handing them over would violate HIPAA. They went through a huge thing, and while a compromise was reached, I believe this really demonstrates how very fragile the privacy of our health care is in the United States today. This is outside of the issue of defunding. You have no idea within different states the depth to which ultra-conservative members of their Congresses and Senate are going to try and make sure that Planned Parenthood services are not available, or to intimidate and scare a woman to believe that if she goes to a Planned Parenthood, somehow or other, her records are going to be possibly violated. It really is the slipperiest of slippery slopes. This was related to garnering names of women who had come to Planned Parenthood in St. Louis to talk about abortion services. But there are very ideological politicians out there who are really after keeping us from accessing contraceptives, because they believe, and clinically, many contraceptives do not prevent fertilization, they prevent implantation. And so therefore, there are numerous forms of birth control that politicians want to ban because they believe they are really creating an abortion, because they believe life begins at conception. So we have seen in Mississippi and other places heartbeat bills, personhood bills, that the minute that there is a conception, that becomes an individual who has rights over the mother. We've been able to defeat most of those, but I will tell you, with the makeup of the Congress, the makeup of the Senate, and the makeup of the country in terms of being extremely right to the right, I think we're going to see many of these kinds of things come back. They may not hit you here in New York, but they're going to hit people, women all over this country, and we should care about that. So if a sufficient number of elected officials in a state want to see those methods banned, could women be subjected to having their medical records subpoenaed to see whether or not they are considered possibly aborting because they are on certain types of birth control? To me, this is extremely scary. Yesterday, and I'm going to quote, this was from the New York Times. It said the worry now among advocates for lower income Americans and the sick is that the Trump administration might seek to undermine the healthcare law through administrative steps. For example, officials could seek to reduce subsidies that help people earning just above the federal poverty line for out-of-pocket costs. Republicans in the House sued the Obama administration in 2014 to block those subsidies. That case is still pending, and the Trump administration could decide to stop defending the subsidies. With such a move would only compound the mistakes it made trying to rush a half-baked bill through the House. And so what I'm drawing us back to here is the idea that we had a victory on Friday, but there are numerous administrative ways that Planned Parenthood, through administrative functions or through the budget or through a lack of appropriations in the budget, could be defunded. And we just need to be completely wary of things that we read and have a complete understanding. I will tell you that Ashley and Fran will not let us miss one heartbeat, because they'll be getting out their updates at all times about what the latest threat is. Okay, so we're here now. What is next? Well, we expect to see the appropriations bill come out in April, and we believe, we have been told that there is more than likely there's going to be a defunding of Planned Parenthood from the Title X program in that, as well as making us ineligible for the deeply discounted drug program, which would hit us extremely hard. If these don't happen in fiscal year 17, we believe it'll be one of the first things on the agenda for fiscal year 18. This is where I want you to really give a heads up, and that is, as I said earlier, we've been somewhat smug in New York State about our ability to access full range of reproductive health care, including abortion services. But our abortion law was signed in 1970, which was 3 years before Roe v. Wade. Again, progressive state, liberal abortion law, except that the law was signed to protect doctors who did abortions up until the point of viability, and it was written in the penal code, and it gave doctors the right in New York State to perform abortions based on the life of the mother, so that a woman whose life was in jeopardy, who was pregnant, could have an abortion. 3 years later, along comes Roe v. Wade, signed into law, which states that a woman in the United States has the right to an abortion in case of the life or the health of the mother. So here we are now in New York with our New York State law in the penal code restricting abortion services to the life of the mother, superseded by Roe v. Wade. Nobody ever did anything about what was in the New York State law because we had the protections of Roe. All of a sudden, we are now seeing the very real possibility of appointments to the Supreme Court. We have heard from our current president that it is his intention to make sure that Roe goes down. These are lifetime appointments. We have a lot of years here, folks, that another 2 appointments after Gorsuch could have an impact on overturning Roe v. Wade. So we are extremely busy in New York State from an advocacy standpoint to make sure that we can update our laws in New York State for a woman's right to have an abortion by getting it out of the penal code, putting it in the public health code, and upgrading the language to be able to say that a woman has a right up to the point of viability to an abortion in the case of the life and the health of the mother. We've worked for a couple of years on this. We have had just a wonderful experience with our assembly. It has passed each time. We are extremely proud of Senator John Bonasek, who is a Republican, for introducing this into the Senate. We cannot get it through the Senate. And until we can get this law passed in both the Assembly and the Senate, if Roe goes down, our reproductive rights and our access to abortion services in New York State could be severely curtailed. So what do we do? What can you do? My final message to you is we have to stay involved. The activism that has been taking place here in Dutchess County and Ulster County, Sullivan County, Orange County is fantastic. But the groups that are being most active, I believe, are here in Dutchess County. Trish told me that she had heard there were 17 groups just in Dutchess County alone that had risen up as part of the Indivisible movement. So I urge you, get involved, stay involved, because the range of social justice issues that we need to support and we need to fight to keep, we are part of that. If you would like to get more involved, specifically with Planned Parenthood's activist movement, Ashley's back at the back table and would be glad to talk to you about what that would look like. For those of you who have donated to us in the past, please continue. Please continue to stretch that donation if you can. How about making your next Well Woman visit at a Planned Parenthood health center? I think probably the one thing that I will leave you with is that the most important thing we need to do is to be committed to electing officials who go to Washington and who are our representatives in New York to stand up for reproductive rights. We will, at Planned Parenthood, be doing massive get out the vote. The activist groups in Dutchess County will be doing the same thing. We can go on marches, we can hold our signs, we can shout our heads off, we can get letters to the editor into the paper, but until we decide that we really understand nothing is going to change, until we have the right representatives, both in New York State and Washington, we are going to face a continued onslaught of threats against women's reproductive health. Thank you. So,
I just would like to,
I don't think you're on.
yeah.